The gallbladder is easily visible when it is filled. Then it is kind of a black hole in the abdominal area. In primary care, the gallbladder is not always filled because sometimes the patient comes during night or after a meal. The gallbladder is visible from the front and from the side, from an intercostal view, and I will show you how you can easily gain those images. When you look from the front onto a patient, we have 3 probe positions where you can easily depict the gallbladder. One is the intercostal view, one is the longitudinal view, and one is the transverse view. I would like to start with the longitudinal view, which is always possible when the patient is in a condition that she or he can make a deep breath. Then the gallbladder moves downwards and is lying here as kind of a black hole just behind the liver. Turning the probe counterclockwise 90 degrees gives you an image about the gallbladder like that. But as I told you, most of the patients are not in a position that they inhale maximum. So this intercostal view gives you a nice view onto the gallbladder, the portal vein and the adjacent bile duct lying close to the portal vein. The bile ducts are normally very thin, having a diameter from 2 to 4 millimeters, lying partially behind the duodenum, and you can only see them in transabdominal ultrasound here in the intrahepatic part, lying close to the gallbladder, lying close to the portal vein, and sometimes here in the extrahepatic part in the pancreatic head. There is one structure giving you an idea where you have to look for the bile ducts. This is the portal vein. You can visualize the portal vein from the front and, as I told you, very important, from the side, intercostal view. The probe positions I would like to show you to depict and to visualize the bile ducts are a little bit comparable to those I showed you before to visualize the gallbladder. The intercostal view, and there is an oblique view here below the ribs. This is the standard oblique view below the ribs, where you can visualize the very thin common bile duct lying adjacent to the portal vein. This is the probe's position. But as I told you, as it is the case in gallbladder diseases, the patient has pain. Inhaling is not always easy. And then you can go to the side, put the probe here in an intercostal view, visualize the gallbladder, the portal vein, and the adjacent common bile duct.